Welcome back to the Let's Talk Data podcast with me, Emma Crabtree, brought to you by Mirai Talent. Today we're joined by Kay Khan, Chief Data and Analytics Officer and founder of KeyAnalytics, a female-led innovator in healthcare data analytics, pioneering new approaches to data-driven insights. In this inspiring episode, Kay shares her journey, evolving from technical roles to becoming a passionate advocate for data-driven healthcare solutions rooted in empathy and inclusion. She highlights KeyAnalytics' commitment to valuing diversity, innovation, and impact.
There's a fundamental change that needs to happen in our interactions with healthcare and the way information is shared at the clinician level, let alone the analytics that sits behind that as well.
Kay explores the complex challenges within healthcare data, from systemic gaps in data sharing to the critical need for greater diversity in analytics. Her mission is to build inclusive training pathways for underrepresented communities, ensuring everyone has access to the skills and opportunities to contribute.
We're quick to diagnose, quick to prescribe.
Yeah.
But, that may not be the answer. There may be something else that may be behind the scenes that is going on. So I think, empathy is a big thing for clinicians before data literacy, I would say.
Kay's work at KeyAnalytics goes beyond just the numbers. She champions support for women returning to work, addresses vital issues like menopause in the workplace, and advocates for data that truly serves people's lives and well-being. KeyAnalytics is actively working to bridge the healthcare analytics skills gap and provide data solutions and training that drive improvement to healthcare delivery. A must-listen episode filled with heart and insight. Enjoy! Okay, let's talk data. So we could start with your journey, which is interesting, because I know you started early on telecoms, automotive, but then you really found your passion of data and analytics within healthcare, which is an amazing industry and organisation and world to be part of, because there's so much good that can be done. So could you just take us through that early transition and your healthcare journey up until this point?
Yeah, absolutely. So I did my degree in computer science and very quickly went into technical roles within the private sector. And then not long, I soon fell into healthcare, and I really felt that healthcare was the space I was meant to be, because the data, the information really impacts people's lives. And then myself going through the journey of being a mother, pregnancy, toddlers, and all throughout my life, I've touched healthcare in some way, shape or form, aging parents now, menopause, so I think healthcare affects us in some way, shape or form, whether directly or indirectly through family and friends. So I really identified with the data. I've dabbled in other industries, but it's not quite the same. I keep coming back to healthcare. So for me, that's where it really kind of hit home that this data is interesting. I want to find out what the stories are, what impact this data has. So for me, it's not just a dashboard or a ETL or the technical terms. It's actually what's the outcome, what's the data telling us, what's the outcome, how can we improve with this information. So it's about, evidence-based decision making, allowing leaders in organizations, in hospitals, in primary care community to be able to make decisions based on the huge amount of data they collect. So for me, I'm really passionate about making sense of this data to drive improvement.
And has a positive change on society, which is huge. But like you talked about information, because I don't think we talk about information a lot. We can be data rich, but information poor. What we're actually doing with that data. So being in the industry and seeing an evolution, I suppose, in healthcare and data and analytics and how those worlds can collide and support each other. What core changes have you seen within the industry?
Within healthcare, definitely lots of changes. The NHS is more open to change, I think, with the advent of the cloud and having the infrastructure to do all the things that you want to, a bit like how we're sitting. You can start to, I've seen the journey from having IT rooms and being limited to the infrastructure you have to now the NHS going onto the cloud and being able to expand their offerings. So I think still the public sector is a little bit behind, I'll be honest, and healthcare in particular. So I think they do need to embrace modernism within technology as well. Sometimes organizations become very, what I call metric driven. Oh, we need to report this up. So it becomes all about the metrics and what's required rather than what outcomes are we trying to get from this data. So healthcare organizations are hugely data rich. Even if you think of our GP practices, the amount of data they hold on individuals from birth all the way to death, there's huge amounts of information and really, really rich information. But what are we doing? What insights? How are we using that information to improve people's lives? When we collect data, whether it's from our phones, through our medical records, through our shopping, through our banking, you're taking a piece of people's lives in that. It's a footprint of their life.
Yeah.
So I think there needs to be some obligation with the organizations, the people who collect this data, to give something back to that community, especially underrepresented communities as well, the unheard voices as well. So I think we have an obligation. We need to start working that way. I'm not sure we're quite there yet.
Yeah.
But I'm hoping that with people who can tell the story and try to draw insights, there's such a heavy emphasis on technical skills that are required. Yes, of course, those technical skills need to be there. But the narrative, the storytelling, the insights, I think those are really key things we need to develop in our technical people as well, because that's really important. You can't have all this data and just hoard it in one place and not allow people to make decisions from it. And, if a CEO of a hospital needs information, it shouldn't take 3 months to get them, because that's going to be outdated. They need to have information at their fingertips. And actually the leaders of these organizations need to become more data literate as well and get used to working with the data. I don't think there's any field now that doesn't require you to look at data or should require you to look at data. I think everyone should be data literate. Doesn't mean they need to be technical, but they certainly need to understand. And I think COVID certainly taught us that when we were presented with all these graphs on our television 24/7 around, the rates and what certain things meant. And I think people started to look at healthcare data very differently during that period, that, there's huge amounts being collected. But where are the insights?
Yeah, I agree. I do think there's missed opportunity. And obviously, I don't want to, we're very lucky to have the healthcare that we have and the NHS. But even being a patient and interacting at that level, data is very unique in healthcare because it does follow you. It's a journey, with the individual through from when you're a baby all the way up to being older. And I feel like it lacks empathy and tailoring and personality. And when you go to the doctors and you engage, and then you see another doctor and you're having the same conversation, you think, and sometimes those conversations aren't easy to have. There's a lot of emotion involved within health, and you may just forget to say something. And I kind of think, do you not have this information already? Because it's quite hard to put someone through a same situation if there's trauma involved or whatever that is. I think we could be more empathetic with that data because it builds a picture, but that's often lost. And is that because the data isn't shared, or is it shared, or?
Unfortunately not. It's not shared even at the clinical level.
Really?
Having navigated, the healthcare system with my daughter as a teenager, and the times she's had to repeat what she's gone through with different clinicians in different settings is alarming. And I'm sat there thinking this should be connected at least at the operational level. I know we need to do it at the back end in terms of data warehouse and draw the long-term insights, but there's something around shared data at the forefront of a clinician when they're looking at a patient, so they can see them holistically. But the systems are disconnected. Theatres has another system, endoscopy, I know these are medical words, but they're all different areas in a hospital, and they have all different systems, and they're not connected. Some things are shared. We have something called the shared care record, where some of your information is visible to all clinicians, but have the last 2-3 years, I can tell you it's not connected, because you have to repeat yourself and go through some of those difficult conversations to say, actually, do you know that this happened? Do you have a clear picture of that? And sometimes even the clinicians are overloaded with information. Your GP can be sat there with your record with many discharge summaries from hospital or wherever. How are they supposed to absorb all of that in a 10-minute appointment?
Yeah.
So I think there's something fundamentally, there's a fundamental change that needs to happen in our interactions with healthcare and the way information is shared at the clinician level, let alone the analytics that sits behind that as well.
Yeah. Do you think there's enough done, I suppose, from a data literacy point of view then, for those clinicians, doctors, nurses to understand the data and paint the best picture? Because, with health, a lot of it is linked. Even if it's depression, for example, you may have been misdiagnosed with depression. It may be in fact ADHD or something else, or it could be related to chronic pain that you have, and this is all a picture that needs to be painted. It's not often one separate thing. There's a reason why, because how the body interacts with itself. Do you think that doctors and nurses and those in these professions need data literacy programs?
I think certainly they need to be aware of the data, but I think it's more about looking at individuals holistically, and because we're quick to diagnose, quick to prescribe. But that may not be the answer. There may be something else that may be behind the scenes that is going on. So I think empathy is a big thing for clinicians before data literacy, I would say. I would say that more and more clinicians are getting involved in the data analytics world. I don't know that I've seen that change over the last 5-6 years, where they are interested in the data and what the data is telling us. But certainly on a clinical level, when speaking to patients, I think for me, what I'd like is a holistic view of myself and my journey and where I'm at in my life, as well as a holistic view of the information they have recorded up to date in their system. So I think, possibly AI could help with that. Because, even for the clinicians, it's not fair 10 minutes to kind of see the patient, listen to their complaint, diagnose, prescribe. That's the kind of journey, or not prescribe. But I think there's an opportunity with the help of AI, as it helps many people, to maybe speed up some of those things. We are short-staffed. We are overburdened in NHS. So I think we need to find more efficient ways of handling patient care in every setting.
Yeah, definitely. And then within, I suppose you stepped outside of interim consultancy roles to start KeyAnalytics.
Yes.
So how's that been as a journey to start your own thing?
Yeah, I mean, life as an interim, as a contractor, it was very comfortable. I've spent most of my career as an interim. I loved doing that, changing, settings and having different challenges, tackling with different problems. But I think I came to a point in my life I wanted to do something different, something that makes an impact. So it's not easy, because you have to come out of your comfort zone and start to think about not just what you did for a living, but actually everything, how to run a company, hiring people, your strategy, what you're trying to take how you're trying to take the company forward. So I think I have challenged myself, but I know that the things that KeyAnalytics represents is tapping into those spaces that I'm really passionate about. Training, data and analytics, open data. So for me, it's an opportunity to not just have a job and have a start and an end date. Actually, you're trying to make an impact, and it helps because you move away from the red tape. You are able to make decisions quicker. You're able to have those conversations that need to be had. So I think moving from a very comfortable area to a very exciting time in my life, I think. It has its ups and downs, as you know, when you set up something yourself. It's a very lonely, isolating place. It can be, but also very... every day I wake up with a spring in my step and I say, right, what's the challenge today? So I think just building that resilience to overcome any kind of small hiccups that you might find you're, overcoming, and just dealing that with some kind of learning and not to be afraid of failures. I think that's the biggest thing, that yes, everyone makes mistakes, has failures, but it's how do we learn from that and move forward? So it's an exciting place for me. I love the decision I made. I don't think I would regret that and go back to what I call the comfortable life of,
totally.
Having a 9 to 5 and switching off, because I work all round the clock and I love it. I love what I do and what it represents.
Yeah, I think when you're purpose driven, it does make it easier, but it can be consuming as well. And it's interesting when someone will say to me, how's business? I'm like, depends on which hour of the day you talk to me. I don't know if that's my emotions or something else at play as well, but it's literally like I can be on cloud 9 or I can be like in despair I think you feel all emotions in one day in business, because the wins feel so rich and rewarding, but the losses feel so like almost personal as well. Like, like you said with hiring, or if a relationship doesn't go well, it hurts. It can really hurt. But it is freeing. And I think it's a great a position of privilege as well to be able to start a business. And I suppose you've had years of experience and now you're in a position where you can guide others and there's things that you feel passionate about. So there's 3 core pillars of KeyAnalytics, aren't there? What are those pillars?
So first one is training. There's a huge skills gap in this area, data and analytics. And we know not just in healthcare organizations, in every industry, it's just so difficult to hire people with the right skills to be able to do what the organization needs, provide insights from the data. So there's a huge skills gap. So training and hands-on training, not you're just, I've been on tons of training in the past, and I don't want to go on a training course, which I'm just going through exercises, learning the theory, because chances are I'm going to forget it when I get home. And I've been on many of those. So this is about real immersive training, hands-on, and not just the theoretical, but the practical side of things is really important, and the mentoring that goes with it. So we have an intensive 2-day boot camp where you come in, you're ready to go. You need to come in, your brain is going to hurt. It's like being on a fitness boot camp, right? You need to hurt. You need to be taught the right way of doing a squat, a sit-up. And then after those 2 intense days, when you've learnt the ropes, as we would say, then we have a 2-month mentoring period where we introduce challenges through our forum. We get on a call with you. Where are you stuck? If you're gone back to work, or if this is new in your career, how do you tackle some of those? So bringing some of that to life. So they say it takes about 60 days to really properly learn something. So we kind of incorporate that in our learning environment. The mentoring is so important to guide you and to work with real data, healthcare data. So we incorporate open data into our learning. So you're dealing with real data. Yes, it doesn't have any sensitive information or confidential. It's all in the public domain. But we take those raw data sets and say, right, here we go. How do we take the journey from a raw data set all the way of telling a story through a dashboard? So there's room for people to see. Data and analytics is such a big area that you could be sitting there programming away, or you could be doing the analysis, or you could be building a dashboard. So there's room for every type of person. So whether you're a creative and you like to see how things look visually and be able to explain them to your stakeholders and tell the story, there's room for you in analytics there. And if you just like to code and program things and you enjoy that, there's space there as well. So I think people don't realize that there's such a varied space for people depending on their personality in the world of data analytics. So for us, training is a big thing. And then obviously our bread and butter, we provide consultancy and services to healthcare organizations. So where they've got a gap, where they've got vacancies, they're not able to do, they come to us and we provide a service where we provide the things that they would expect out of a hire, for example. We know lots of organizations, I speak to many that, have got vacancies and they can't hire, are unable to hire, recruit to those vacancies despite going to advert. And there's such a push not to hire interims in healthcare and all government but private sectors. So I think they're kind of looking for a service to deliver in their organization. So we do the consultancy side of things, whether it's delivering a project, a dashboard, ETL work. And then the third one is around open data. So we are building open data platforms, and I'm hugely passionate about that. There's such a huge amount of open data being published in the UK in different areas, whether it's demographics, crime, census data, huge amounts of healthcare data. It's all being published and pumped out, but not enough insights from it.
Yeah.
So we're really building something that would provide, allow organisations to benchmark, to compare, to see where they are, what the public data is saying about their organisation, and something that we're really passionate, and I have been passionate for many, many years about that. It's amazing, but it's all sitting there in its raw format. So, you know, I think there's a huge opportunity in open data, drawing insights from that. So those are our three core pillars in our offering. But yeah, I think those are, and you know, behind the scenes, obviously, those are our core pillars of delivery. But below that, it's creating safe spaces for females to enter this space. I know it's hard, it's daunting. If you want to enter into a career in data analytics, where do you go? So we create those safe spaces and make sure there's diversity. So it's also having these three offerings, but having a diverse team.
Yeah.
And bringing, I think diversity brings innovation and different ways of thinking. I know diversity is a bit of a tick box exercise for a lot of organisations because, oh, have we got that? Have we got that? It shouldn't be. It should be an opportunity to innovate, because different perspectives bring different things to the table and you innovate. So I think for me, all these values underpin us, despite the three core technical offerings, as I would say. So it's what we stand for and the safe spaces we create, cross-generational, ethnicity, gender, all of the things you can think. We're open to building a team and organisation that opens up the doors to diversity, not just by a tick box exercise, but the real deal.
Yeah, I mean, there has been a pushback on the pushback, and the pushback is from those companies that used it as a tick box and then are blaming the fact that it was a tick box for it not working. And it's like, we approached it in completely the wrong way. You know, it's not a tick box exercise. Someone doesn't want to be positively discriminated. You know, that's the worst thing to think, oh, now I'm the only female because you didn't have females, and then it's not inclusive. So then they don't thrive in that environment. So it's not just diversity, it's DE&I is so important. And there's so much data around the innovation, problem solving, and just seeing things from a different point of view. You know, we work with some companies that are quite specific on education, and I quite try and challenge that, because I'm like, okay, but surely those people from those universities, as great and bright they may be, and they are different individuals, I appreciate that, but they are taught to solve problems in the same way. You know, what about someone that didn't go to university but has had life experience in a different capacity? So it just spans a whole range of things, and I think that is such a beautiful, pure thing. And why pigeonhole ourselves? Because people are so unique.
100%. Education is important, but life experiences are as well. Some of our best developers, team members, don't have a university degree. I think, I know this is controversial, but, you know, you go to university, you come out with lots of debt, and then are you guaranteed employability? You know, no, I don't think that's the case. I think we're living in an era that, you know, degrees don't guarantee you a good, secure future in your career. So I think we need to really think about what the universities are offering and how it's linked to industry. So for me, no, not at all. I think the degrees and the certificates don't matter. Actually, it's how you work as a person and the life experiences and your approach to problem solving. And your hard work and effort. That's what counts. And I don't think that, can it be taught?
No, I don't know.
It's a big question.
Yeah, it is. I think you understanding the skills gap within data analytics and AI as well, it's ever evolving. But I think we don't really look at transferring people into the industry. You know, that there's so many people have data skills without realizing they have data skills, because every day we interact with data. You know, whether that's a shopping list, whether that's your playlist, whether that's your finances, whether that's your Garmin, whatever it is, you interact with data. So I think people don't realize they have the skills, and just giving them that confidence. So when you say, if someone goes into your boot camp, and I love that you have a boot camp, and it absolutely does need to be intense and engaging and interactive, what can they expect at the end of the boot camp?
Yeah, so what they can expect at the end of the boot camp is actually a guaranteed job interview.
Fab, wow.
Yeah, so we have many people, our partners, who are looking for people with the right skills, but don't want to just go and cold hire because they don't know what they're going to be dealing with. You know, a CV is a CV. You know, we can put all sorts of lovely things on our CV, but how does it all transpire? So they would, the preferred partners that we're building up to are the ones that they would be guaranteed a job interview with, having gone through the boot camp and the mentoring. And we see that, yes, you've actually put the effort into making sure you've got the right skills. So we make them employable, ready for interviews.
Yeah. And will these be entry-level roles across the data spectrum?
100%, yeah.
Excellent.
It depends. You know, they might already have skills in Python or SQL, but they actually want to do the Power BI dashboard skills, and it might just enhance there. And they may already have. So it's not always, you know, for many, it might not be the job interview that appeals to them. That's an offering, but it might help them with their current job to upskill. So it depends on the person, but that's certainly something that we have on the table, that having gone through the program, this is what you will be offered.
Yeah. In this space, it can be very intimidating because we all know that it's an ever-evolving space. So you can really get cut short if you're not upskilling constantly. But I know something you're passionate about, and it's an interesting topic, is women and, you know, men maybe returning to the workplace. It may be illness, but having children, whatever that is, time away from the workplace, coming back is so intimidating. But we all know those people, you know, and some partners I work with as well, it's about educating, like, why haven't they worked for a year? I'm like, it's not that long. You know, and then maybe they've been a carer or whatever it is. But some companies really just look at it in a very black and white way. And I'm like, life is great. And in that time, they've learned other things that are going to help them. You know, maybe it's resilience even, or negotiating, or whatever it is. They've had life skills that are going to help them. They may have just had a really hard time, whatever it is. They haven't lost those skills, but yet at the same time, maybe they are a little bit behind in terms of the more technical aspects. So what can we do to encourage, welcome, support those who have been out of work back into the workplace?
Yeah, absolutely. I agree with you that, I mean, for example, women returning to work, having had a long career break, say, looking after children. And I found myself working, you know, having friends in the same position. I was the one working. Lots of my friends weren't. They were stay-at-home mums. And I remember feeling the guilt, thinking, oh, I'm the one running back and forth to the assemblies. I've got to get to work and what have you. But then after some years passed, and I was like, they're saying, oh, I need to return to work because the kids have grown up now and they're kind of doing their own thing. So it started to reverse. So I started to see a different perspective from their point. And the challenge of returning to work is huge because if you've been out of work for a certain number of years, it's huge. But I think they should feel confident to return. I think there is something about upskilling digitally, but we all have to. I mean, what I knew 2.5 years ago is very different to what I know now. So everyone has to constantly keep up with the technical space. So I think that's easily done, you know, and navigating around what's new. You know, someone 5 years ago in the technical space might not be able to navigate Teams, for example, but Teams has become bread and butter, and Zoom has for lots of people now because we work remotely. So I think it's just giving the confidence back, because I think even as mothers, you learn so many skills: negotiation, conflict resolution, empathy, which makes you it's so many skills, and you just have to look these up, that actually you can bring a lot to the table in organisation, especially in leadership positions. You know, I remember being interviewed by a CEO some years back, and she had quite a difficult information team that she wanted me to come in and try and find out what was going on, why the board weren't getting what they needed in terms of information. And she says, well, they're a very difficult team. How are you going to handle them? And I said to her, and I didn't know how to answer. And I said, I've got teenagers at home at that time, thing. So, and she sat back and laughed and she goes, you're right, actually. There is something about, certainly in my experience that I'm talking about motherhood and the experience and the skills you gain through that period. But anything you do, I think if my daughter took a gap year in between her school and university, I think that did the world of good to her. She's gone back seriously and is really taking university seriously. So I think as employers, we shouldn't question why have you been out of work? Yeah. Well, okay, what skills have you developed? Whatever you may have been doing over those years, what do you want to achieve? And I think that will put a fresh perspective. So I think as employers, we need to think differently about people. Just because somebody's gone through the channels of, doing their levels, doing their degrees, following the path and never been out of work, are they necessarily the best employee? Not really.
Mm. Yeah, we do need to reframe it, don't we? Because it's almost like we just define someone by that career trajectory. And is it what they've done? So it's familiar because we all seek out that familiarity. But if not, I think it's just like job descriptions. When you look at job descriptions, have they evolved? Like a lot of them are just the same format, the same wording, the same requirements, the same aggressive undertone, like you must. And I think we just do things as we've always done them without questioning. Because if you said to someone in reality, okay, and I do challenge people that I partner with in the way that, why do you think a couple of years out is a detriment? Why is traveling, just because you wouldn't travel, why do you think it's a bad thing? Because having lived abroad myself, I know how enriching it is, how formative those experiences can be. And some people just maybe have been unfortunate or unlucky with life as well, if they've needed to look after someone, but maybe for them it wasn't an unfortunate situation. Maybe that's something that they wanted to do. But you're right, there's so many different, and Roseanne, who was just in the studio before, referred to them as power skills. They're not soft skills. These are powerful skills that can help us get above. I mean, have you seen a shift in that and what's important in the workplace to thrive?
I think I have. Certainly in my experience, I look for different things. I focused less on people's qualifications. I look at the person behind it, what they've done. I look for adaptability, flexibility, a good work ethic, and skills outside of work as well. I often ask in an interview, what do you do outside of work? I'm interested in the person. Tells you a lot about them. So I think all of the other things can be learned. If there's gaps in what I may perceive in them, those things can be, upskilled. But I think hard work, a well-rounded person, a joy to be around. I know that's overstated, but it does make a difference. And also when you look at people, look at, how not well they interview, but what's behind it, to dig a bit deeper, because some people don't interview very well, but they're geniuses in their own right. And, we talk about neurodiversity, and you see that in people as well, that maybe the communication skills are not there, but they're amazing at something technical that you need to happen in your organization. So I think we need to look at people through different lenses rather than saying, right, everybody needs to have, it's the bog standard, you need to be this, X, Y. There's a list of things that, usually come in a job description. And if you look at any job, they all require the kind of similar type of thing. So I think we need to think out of the box depending on the role. So, you wouldn't want somebody with, say, ADHD on the spectrum to be sat in front of a computer all day. They need to be up and about. There's fidgety, we all kind of, so I think we need to just be careful around bringing the strengths out in people and what job they suit, and make them aware. And when people join our organisation, we actually do a personality test. It's called 16 personalities, and the ENFJ, those type, and that really helps to get under the skin about what that person is about. I know certainly when I read mine, I was like, yep, spot on with that. That's exactly, and it allows you to see how you work with different people. So just understanding that people are diverse in the way they are, and seeing where their strengths are, and making sure their strengths are applicable in their position as well. So I think, yes, you have to look differently. I think there is a shift. But it's a slow shift.
Yes, it is.
Yeah.
I think inclusive hiring practices are key. And like you said, personality test to build a picture on someone is brilliant. Mm-hmm. But I saw something recently, and it was actually a lady who came to one of our events that met a hiring manager at an event, and she went through their interview process and actually had a conversation on LinkedIn with the guy and was like, I've failed. Like, I know I failed because I'm neurodiverse. I just can't answer in the way that you want me to answer. Mm-hmm. So she kind of called out the process, not in a begrudging way, just like, I really want to work with you guys, and I got a computer says no kind of response. And anyway, he really heard that, mm-hmm. and is an advocate himself of ADHD and neurodiversity. And she went through a more inclusive, tailored interview process and got the job. I was like, I love that. I love that you challenged it.
Yeah.
And how, really apparent does that make it that so many people aren't getting jobs because computer says no?
Yeah.
There's so much grey, and it's like, you didn't tick that box. And like you said, maybe someone's a bit fidgety on a Teams, or, they weren't listening to me. No, well, maybe they are listening and they just didn't make eye contact because that makes them nervous.
Maybe just don't have a 2-hour call with them. As simple as that. They're not going to be able to retain what you've just, told them. And I think there's some simple strategies. And my son has ADHD, and he self-diagnosed himself at the age of 16. I got him assessed, and you're definitely on the spectrum. But had he gone through the traditional schooling system, on paper he'd be a failure. But because we were able to play to his strengths, which he has many of, he's able to do a job that he enjoys and thrives in. So I think we just need to make sure that we're, from the schooling system all the way up, from upskilling, we're putting people in the right places that builds on their strengths, rather than putting everyone in a box.
Of course. Yeah. And I do think we are getting better, because if you think about generations before, like, work and personal life is so separate. And there's kind of that like toxic positivity, like, don't bring your issues to work. And I get it in a way. We don't need to. I think for me personally, if I've had an issue, I feel better trying to forget about that issue for a bit and going into work mode. But sometimes it's not that easy. And I think from a health perspective as well, something that I know you're talking about a lot more recently is menopause. But we know that women's health as a whole has been underfunded, under-researched. There's a huge data bias in it. So how are you seeing that play out in the workplace?
Certainly with myself personally, first of all, the research and funding for things like menopause are not there. I think 2% of all funding is allocated towards female health. And I'm sure that 2%, probably hardly any goes to menopause, yet it affects so many women of a demographic that we're ready to go. We could be a productive cohort of society. And certainly I've experienced that with myself. I've raised my children, I'm independent, I'm ready to go, I'm, building my company, doing all of those things, and then you're suddenly hit with menopause. Like, where did that come from? I didn't know I was going to feel like that. So it's just when you've got your shit together, you think it's all coming down again. So, but it's there's no way of navigating. So I'm very lucky. I've got some amazing friends who are a few years older to me and advise me on what works. But why isn't that knowledge widespread? Why aren't we doing proper research as to what are the options? How do we handle, from a well-being point of view and, a physical point of view? So, I posted yesterday and my daughter described it well. It's like it's like puberty, but in reverse. And I thought, it is a challenging time in your life, but it's how do you step and navigate through it? And I don't think there's enough help. I was at the GP earlier this week and I have been talking about symptoms, things that I'm noticing, all that type of stuff. And it was just a bit like, okay. Off you go. So we are kind of left to our devices. And then, there's so much out there. And then there's an opportunity for companies to, not necessarily there's a lot of selling going on around menopause, and you go to Holland and Barrett and there's a whole section on menopause and what you can and can't take and what you should be taking and the type of things. But is the research behind it? Are we just kind of going into
Is that more for a commercial gain?
Yeah, it's commercial, and the commercials are gaining space in there because actually we're not doing enough proper research and we're not collecting the information. And I said this yesterday in the panel that every 3 years, females are after the age of 24 are called in for a smear. We're called after, if you're 40 and above, you're called in for a health check. Why can't we just add on, the menopause check, or how you doing, how you're navigating this? Do you need help? Or some people, everyone experiences menopause differently, so we have to acknowledge that. But there's no kind of education around it as to what's coming next in your life and what you need to be prepared for, what you need to look out for. It's kind of, people are silent on it. And I think more needs to be done in terms of research, data. We're not collecting enough data. How can you do the research if the data is not there? There are some studies and obviously very good, valuable studies, but it's on a cohort of, people. We need to do it wider, because then problem with doing it on a cohort is that you might be missing a huge demographic that might be handling the symptoms differently. So I think it needs to be looked at and reviewed, because it's a cost to the economy.
Yeah, of course it is. I've got some data that you actually shared on your post. So 1 in 10 women leave work due to menopause symptoms. An estimated 2 billion in lost productivity in the UK each year. 77% say their symptoms affect their daily lives. And like you referenced then, less than 2% of global medical research funding goes towards reproductive health, not just the menopause. And menopausal women are the fastest growing demographic in the workforce. And, it's upsetting. It can be isolating. It's hard to navigate. And I suppose for you as an individual, it's hard because we're never really taught about these things. It's like periods and female health as a whole. Yeah. It's like, why are we talking about this? Why aren't we talking about this?
Yeah. 100%. It's a subject that, I'll be honest, it's not a comfortable subject. I don't want people to know what I'm going through. It's something, you kind of naturally in a professional work environment, you want to just turn up and get on with the work that you're doing. But life is not like that. There's so much that goes on behind the closed doors that, but I think we need to start learning to be vulnerable as people and sharing things. So, and arming the next generation. My generation might not be armed with the right information, but we need to do something that my daughter's not going to go through the same, and it's a shock to her. It's things like postnatal depression when women have children, and there's a risk of depression in that era of life. There's a lot. I remember a health visitor asking me a whole lot of questions after I had my first child. How are you feeling? And I wasn't feeling great at all, mentally. And why isn't that there at the stage of menopause? But I think people need to incorporate some of that into the workplace, check in and acknowledge that these changes happen to women at this stage of life, provide the support and well-being. And, I think I've got another 20, 30 years to give back to the economy.
Of course, yeah, I know.
I want to give it back. Please don't let me go, fall into it. But, there's proactive things that you can do, but the knowledge isn't widespread.
No, but we've known for years how detrimental it can be to a woman's health, because years ago, women were sectioned when actually they were going through the menopause, so deemed unfit to, be in society. Yeah. Or even before that, I think there were witch hunts for women who were perhaps acting that wasn't in accordance with how they thought females should act. Yeah. So we've had it tough for many years. I mean, I know there's some great organisations and charities. There should really have to be charities for this, but partnerships, I suppose, and some corporations and smaller companies as well. I know some startup companies that are partnering with female health specialists so they can guide and, give that advice. Do you think there's like should be a standard throughout industry that we should see?
In terms of workplace?
Yes,
Yeah, I think, there needs to be, within the workplace, certainly in the healthcare system, there needs to be check-in. Look, when we're having our smears, our health checks, our workplace doesn't really have anything related to as long as you're okay. I think whether it's in the health system or more help in the workplace in terms of understanding that there's certain days that you're not going to be on top form and you need a down day, and to understand that, to give space for that. I think it's important for workplaces to acknowledge that if a female of a certain age is working in the organisation, to have steps. I'm not sure what those steps look like. I'll be honest, I'm not the expert in terms of knowing what we need to look out for, but I do know someone's a female and they're of a certain age, chances are that they might not. We all differ in how, what age and thing, but we need to look out for it and be educated about what to look out for when that happens. So I think there's things within a workplace that can be done. And I think 20% of workplaces have things in place. I'm not 100% of what those are. But certainly in the health system, we need some changes. And not just for the sake of well-being, but the sake of the economy. We're a productive, cohort of society. We can do some amazing things and, drive the economy. Why are we not seeing this issue that can affect this cohort?
Yeah. From an economical point of view, Japan are very savvy because, as we know, illness in the workplace costs lots of money. If we want to look at it from a commercial perspective, they, not all of them, but I know most corporations and businesses, they pay for full health checks for their employees once a year. And that's full health check. So we all know that not just obviously menopause and female health, but cancers, whatever it is, they go undiagnosed for too long.
Yeah.
And most people, like I know, and I think this is more a male issue maybe than a female issue, they don't go to the doctors enough. I know, my partner, I don't think he's been to the doctor for years because he's like, I'm fine. I'm like, I'm not sure. But who am I to say? But if once a year you have a full check that your company pays for, however many £100 it is, isn't that just brilliant?
Yeah.
Who doesn't benefit in that situation? Now, the thing is, on the flip side, some employees may think, well, I don't want my organisation to know this about my health. So there is that element because you're basically opening yourself up for, if I get a diagnosis, my company are going to see that. So I understand that. But I just think that is so forward thinking and innovative.
100%. Our healthcare system has become very reactive. Something goes wrong, then we deal with it. But what about the proactive care around what you could do? Health, exercise, we all constantly should be reminded about the benefits, the preventative side of things. And, public health is such an amazing area that I feel that is hugely underfunded, where that proactive care is pushed out and made known to people. I know we shouldn't be spoon-fed, but the messages need to be loud and clear. If you keep fit and healthy, if you do strength training, especially after the age of 35, it's going to benefit you hugely in your long run. We know this, but we need to be reminded as humans, otherwise we go down a slippery slope. So I think it's not enough messaging there. And public health is one of those organisations where it's about preventative. Let's not let the problems arise and then tackle with them. And when there's a huge cost to the system, let's try and invest in proactive care and the messaging for people to be able to take on that self-education, because it's in our entry. We kind of know what are the things that we need to do. I'm not, obviously you need to do the checks. That's proactive, because what if you didn't have that check and you've been diagnosed with cancer years later and it's now gone too far?
Yeah.
But a year later, before, if you had been diagnosed, that might have, your survival chances might have been much more. So I think we need to think about that. I mean, if you're in that situation, I didn't. Yes, your employability, etc., your organisations knowing, there is a confidentiality issue there as well. But I would encourage health checks, but I'm not sure those kind of health checks are easily accessible for companies to provide for their employees. I mean, I'm going to have to look into it, but I think it's an amazing idea. It's something that you've just triggered.
I think so. Well, look how quickly we could test for COVID, though. Yeah. Like, if we need to change something, we do shift. So we definitely have It's possible. It's just whether the desire is there and the upfront expense.
Yeah.
But in the long term, it will save money. But in the short term, it will be an investment.
Definitely. I mean, you want, if you're running a company with people in there, for them to be well in all ways, well-being physically. So I think there should be, and I think in other countries there are those things in place. It's just, I think in the UK there's not.
No, there's not.
It's not widespread at all. So I think there definitely needs to be more done around physical, mental well-being, and at different stages of people go through different things in different stages of their life. So it's about having the understanding and the flexibility to manage people because people go through different cycles in their life. So we all have those down periods, or when we're dealing with something turbulent. My brother passed away 2.5 years ago, and it was a really difficult time in my life. I was looking at my work and thinking, my brother's just passed away. How do I deal with those emotions? Grief, loss, many, many things. So I think we just need to sometimes understand people.
Yeah, we do. And data can help with that as well.
Yeah.
So we'll move on to the quickfire data lightning round.
Yeah. Oh.
What is a misconception about data that you'd like to debunk?
Data's for the technical people only. I would say that if you've got a curious mind, an investigative mind, come to data.
Yeah.
Come to the field of data analytics. There's this big notion that you have to be this programmer, you need to learn a language. No, that we need people who can tell the story and put the narrative and be inquisitive about what the data actually hasn't told us yet. What's hidden? What are the hidden messages? And I think that is a big misconception, that you need to be really techie.
Myth debunked. Number 2, name a book, podcast, or event that every data enthusiast should explore.
Let's talk data.
Great answer. Number 3, finish this sentence. Data is the key to
wisdom.
Yeah, I like that. That was very quick. Number 4, what is a piece of advice you'd give to someone who's just starting in the world of data?
I would say have an open mind. Look at all the different areas within data analytics and see what suits you in terms of the technical coding, the dashboard building, the storytelling, and see what suits you and hone in on that. That's the advice I would give. Don't do something that is not comfortable. If you're not a coder and programming is not your thing, don't go down something. Yeah, don't force it. But there are areas in analytics that you can enjoy. So look at it as a wide spectrum of skills. Yeah. So I think that's the key.
And last one, what is a data buzzword that you love to hate?
I love to hate big data.
Why is that?
I don't know. It's just been overused. I mean, data's data, big or small, it doesn't matter. A huge amount of data might not give you what you're looking for. We're collecting huge amounts of data. There's sensor data, but what's the key data that we need to be looking into to drive those insights? So that's a word I don't particularly enjoy over the years.
Key data is better, not big data.
Yeah.
Well done. There we go. That's a wrap.
Yeah.